Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about narcissistic personality disorder. In this video, we'll first look at what narcissistic personality disorder is. We'll then look at some statistics, risk factors and causes, symptoms, effects, treatment, and lastly, we'll look at some coping strategies. Narcissistic personality disorder is a mental health condition characterized by grandiosity, a desire for admiration, and a lack of empathy. A person with narcissistic personality disorder can act arrogantly, act selfishly, manipulate other people, and lack consideration for other people's feelings or needs. A person with this disorder can have an unreasonable feeling of superiority. Their feelings and actions may mask their insecurity and low self-confidence. There are two subtypes of narcissistic personality disorder. The grandiose subtype is characterized by grandiosity, boldness, and aggressiveness. The vulnerable subtype is characterized by hypersensitivity and defensiveness. Statistics. In community samples in the United States, the prevalence rates of narcissistic personality disorder range from 0.5% to 5%. In clinical settings, the prevalence rates range from 1% to 15% in the general population. Risk factors and causes. Studies suggest that narcissistic personality disorder is a result of genetics, childhood abuse, neglect, rejection, excessive praise or criticism, having a fragile ego in early childhood, and being hypersensitive to textures, light, or noise during childhood. Symptoms. To be diagnosed with narcissistic personality disorder, a person must exhibit at least 5 of the following behaviors by early adulthood. Have a grandiose self-importance, such as exaggerating achievements and anticipating recognition of superiority without reaching certain accomplishments. Have fantasies of power, success, brilliance, beauty, or perfect love. Have a belief that one is special and only interacts with other people who are considered special. Desire excessive admiration. Feel entitled, such as expecting special treatment. Take advantage of other people for one's own motives. Lack empathy and ignore other people's feelings and needs. Feel envious of other people or believe that other people are envious of oneself. Display arrogance and haughty behaviors. Effects. If left untreated, narcissistic personality disorder can result in difficulties at school, difficulties at work, substance misuse, and suicidal ideation or suicide. Treatment. The most commonly used treatment for narcissistic personality disorder is psychotherapy. Psychotherapy can help a person develop a realistic self-image, improve one's self-esteem, better manage emotions, develop healthier relationships, be responsible for one's own actions, understand one's expectations about oneself and other people, understand the effects of one's behaviors on other people. A type of psychotherapy is cognitive behavioral therapy, which can help a person identify and replace their negative thought and behavioral patterns with positive ones instead. Another type of therapy is psychodynamic therapy, which can help a person understand their feelings, unhelpful thoughts, and behaviors to learn how to relate to other people. Lastly, family or marital therapy can help to improve relationships by learning how to better problem solve and communicate more effectively. Coping strategies. To cope with narcissistic personality disorder, a person can improve their lifestyle by avoiding substances that may prompt disruptive behaviors, engaging in healthy habits such as eating healthy and getting adequate sleep, engaging in mindfulness to reduce stress. Meanwhile, a loved one can help by engaging in self-education and learning how to identify narcissistic behaviors to manage them more effectively. Setting boundaries by disallowing a person with narcissistic personality disorder from aiming their anger or abusive thoughts and behaviors towards oneself. And speaking to others, speaking to friends, family members, or a therapist can help one understand the normalized abusive behaviors in the relationships and better cope. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.